Thank you for signing up for Lobby Day. I'm Kelly Troutner, Director of AFT Nurses and Health Professionals, and here with me is Earl Hadley, Associate Director of our Government Relations Department. We've put this short presentation together for you to give you a little information about the bills we will ask you to focus on next week and to provide you with important information about Lobby Day. In your email, you should also be getting talking points for the bills that we cover today. We will be providing you information also about where you need to be and what time your appointments are scheduled. We have staff assigned to each of our groups who will make sure that you're comfortable and that you know where you're going. This day is about you and doing what you do best, speaking out for patients and for great health care. Aside from the lobbying that you'll be doing on the Hill on Wednesday, we also will be sending an invitation out to all of our healthcare members for a virtual lobby day. The virtual lobby day will have more bills than those we'll be discussing on Capitol Hill, so we encourage you to check that out also, even if you're doing Hill visits. So let's take just a few minutes to go over the issues and the bills that we'll be asking you to speak about during Lobby Day. First is the Nurse and Healthcare Worker Protection Act. As you know, nurses and health professionals have some of the highest rates of work-related back injuries from lifting, transferring, or repositioning patients. Yet the healthcare industry has been slow to adopt recommendations for effective equipment and safe patient handling practices. The Nurse and Healthcare Worker Protection Act will do a few things. It will establish a federal safe patient handling, mobility, and injury prevention standard. It will also provide for related training of healthcare employees, and it gives healthcare workers the right to refuse assignments that do not meet safety standards. Next is the Nurse Staffing Standards for Patient Safety and Quality Act. Our members know that when nurses can spend enough time with each patient, patient outcomes improve. This act would do a few things. It sets minimum nurse-to-patient ratios. It requires hospitals to implement and submit to Health and Human Services a staffing plan that meets minimum requirements, gives nurses the right to refuse an assignment that violates minimum ratio standards, and it also protects nurses from being discriminated against when they refuse an assignment or complain about quality of care issues. Next is the Prescription Drug Affordability Act. A key issue in patients with AFT has been focusing on pharmaceutical company practices, including and especially drug prices. The Prescription Drug Affordability Act would do several things. One, it would require the Centers for Medicare and Medicaid to negotiate lower prices on behalf of beneficiaries for drugs covered under Medicare Part D. It would also require drug manufacturers to issue rebates for prescription drugs dispensed to eligible, low-income individuals under the Medicare and Medicaid programs. Additionally, the Act would allow the importation by individuals of prescription drugs from Canada and potentially other countries. It would also establish restrictions on certain anti-competitive patent settlements known as pay-for-delay agreements, which effectively block generic drug competition, and also would allow the Federal Trade Commission to initiate proceedings to enforce these restrictions against any parties to such an agreement. And finally, we hope that you will implore your members of Congress with whom you speak to support emergency spending for Zika, opioids, and the Flint water crisis. It's very clear that Governor Snyder of Michigan is not willing to provide the necessary resources to help the people of Flint. Flint's Congressman, Dan Kildee, has laid out $765 million in needed emergency funding. Congress needs to take action and address this crisis. Additionally, President Obama has asked for $1.9 billion in emergency funding to fight the Zika virus and $1.1 billion to fight the opioid epidemic. Congress should vote on a spending bill to address these health crises. The lack of investment, as you know, in our public health infrastructure leaves all of our communities vulnerable to crises that they lack the resources and preparation to address.
We are in an exciting election year. For Congress, that means that most of their work will be done by August as they turn back to elections. And we've seen already this year that very little has gotten done. In fact, the majorities in Congress have not been able to pass a budget yet, which is the basic function of Congress. Despite what I've just described, there are a few areas where there seems to be bipartisan discussion about taking action. That includes dealing with opioids, the Zika virus, and the crisis in Flint, Michigan. The crux of the problem is that there's a very strong disagreement about what taking action means. We are very clear that funds are needed to support programs and responses to three crises, whereas others seem content to have press conferences and hearings. This is one key issue that we'll need your help on pressing immediately to provide funding to help those impacted by these crises. Our other goals are a bit more long-term. We want to build a strong foundation of support for the key bills highlighted earlier to make sure that we enter the next Congress in January clear mandate to push for these things. Continued support from the White House and hopefully a much more supportive Congress. But the key to getting this legislation passed is starting now and increasing the number of members and senators who are supporting bills that address our key concerns. I think the first key point is to not be nervous. And that sounds hard, but you are the star of the meeting. The member or senator is there to hear from you. You're the constituent and you're important to them. As crucial, you are the expert. You know more about healthcare than the staff and most likely the member or the senator. And they want to hear your voice. It's crucial that you connect your personal experience and stories with what we're advocating for, whether that's staffing ratios, or safe handling, or public preparedness. Your stories will help move the conscience of the staff and the members and get them to a place where they can co-sponsor the bills and fight for our issues. We'll be providing you with materials that include bios of the members and senators, key bills on healthcare that they have supported and developed, as well as bills that they have co-sponsored, which we think are important. You can discuss these issues as well as what's going on back in the district or the state. They'll both like to hear about that, and that will help to make a connection with the staff, member, or senator. It's important to remember that for the most part, you'll be in sympathetic offices. They'll want to support you, and the key is to make sure that through your experience and stories, you move these issues up their priority list so they take action themselves. Finally, it's key to make sure that at the end of the meeting, you're very clear on what you're asking for. In this case, it's for the member or senator to become a co-sponsor of the bills we've highlighted, or to reach out to congressional leadership.
For this last slide, I wanted to sing to you, but I'll spare you and say that I really hope that you get pumped up. We're really excited to have you in Washington, D.C. for our lobby day this year. The important thing to remember is that this day is about you and it's about your patients. We'll be hearing from some of your congressional representatives at the conference on Thursday. So if you don't get to meet everyone that you have on your list on Wednesday, we hope that you'll be happy with the lineup of speakers that we have at the conference. So get excited, get pumped up, come to DC. We're excited to have you.